Unless Dr. Boyce corrects me on that, that's what we're going to say. Slight flexion is good for Dr. Brodsky. Dr. Longman, are you okay with that too? Okay. Dr. Mary, you all right with that? All right. So basically, you just want to move the patella along the line without creating any tilt. Now, Kaltenborn also suggests that in functional, we talked about that the patella essentially follows the tibia. So we want to actually create a little tibial internal rotation. So internally rotate the tibia a bit if you're going medial. Point the toe in the direction you want to go. Okay? And then take your thenar and hypothenar eminences, and cup the patella, and then just glide it medially, and you should see my forearm going in the direction of my force. Okay, so I'm trying to keep from tilting. So sometimes when you push, the patella sort of skids up, does a wheelie this way, and you want to try to avoid that, and that has to do with how your force is. Okay, so I'm cupping the patellas here, and I'm trying to move it this way without doing this to it or this to it. You can see that through the video or not. You could do a progressive stretch, or you could do an oscillation. So if you want to really stretch that lateral retinaculum, I would just do a stretch and hold it for how long? 15 to 18 seconds. Okay? And again, my forearm is along the line of the thigh, not up here. I just corrected myself. Okay? All right. Also, note that when you're pushing medially, you want to be on the lateral side of the leg so that your force can be directed most easily medially. You could pull it, I guess, across, but you don't have near the control as you do with your thenar and hypothenar area. And with these patellar mobs, that's what you're using, essentially your thenar and hypothenar area, because you can grab that more easily, the pull that you're pushing. And that goes for if you're doing inferior glides as well, or lateral glides. Okay? So lateral glide, just to make it easier, I'll just go ahead and use Jason's other side. And if you want to bring the patient close to you, like that, laterally rotate the tibia a little bit, but don't laterally rotate the whole femur. Okay, so you're just laterally rotating the tibia a little bit, and then grasp the patella, get into position, recheck your forearm position, and glide laterally. Now be very careful with this because there are several people that will sublux in here. So if you are a known subluxer, please tell the immobilizer that and just have them do a grade 1 just to get a feel for the movement. Okay? Most people, again, are not hypomobile laterally. They're hypomobile medially. And they tend to be more hypomobile inferiorly. Okay. And then the inferior glide that Kaltenborn shows. Sure. Let's go back to your right